Good morning. My name's Andy Bates. I'm speaking to you on a beautiful Sunday morning in Kenya. We're here on behalf of the USAID Prepare project that's being implemented by the International Medical Corps. I've been working with this organization as a consultant as well as a partner for the last 4 years in the pandemic influenza field. Today in Kenya, we're putting the final touches on a nationwide regional pandemic disaster scenario that will be presented to the senior officials of the Kenyan government. On the eve of October 13th, International Disaster Preparedness Day, I'd like to share a couple of thoughts that actually coincide with the exercise that we've designed here. Number one, the most important thing in disaster management is to speak to the people and to save lives. This is really what the bottom line of all disaster management is, pandemic as well as others. To do this is a very difficult task, and the government must have the trust and credibility of the people, because we're going to ask them to change their behaviors and yet at the same time remain calm. The reason we have to do that is during a disaster, the essential services and government mechanisms that support society day to day are going to be dramatically reduced. And in order to reconstitute the society, the help of the people is a major requirement. The coordination of the government agencies from the local level all the way to the national, regional, and global level at the United Nations is paramount in establishing a credible presence so that the people will actually participate in the disaster response and recovery efforts. The focus of our exercise here, the particular part that we're looking at in depth with the Kenyan government, is the essential services that the United Nations has identified. Those essential services are power, transportation, telecommunications, banking, rule of law, which includes not only the police but the court systems and prisons as well. We're looking at water, health care, and banking. Once any one of these essential services is degraded, then what happens is it has a ripple effect on the rest of the other essential services. This is a very complex problem, and one that we have put into the exercise scenario so that the people doing the exercise and who will have to respond should a pandemic occur will need to work through the interdependencies of all of these essential services as they begin the response and short-term recovery efforts required. I really appreciate this opportunity to speak to you, and I look forward to working with the Kenyan government. Thank you.